Good morning, boys and girls. Nurse Susanna and I hope you had a great weekend. This week, our theme is going to be taking care of our bodies. We're going to talk about going to the doctor and getting regular checkups. We're going to talk about exercising. We're going to talk about eating a balanced diet. And we're also going to include the body's 5 senses. One of the most important things we can do to keep our bodies healthy is to make sure that we go to the doctor on a regular basis. I know sometimes you go to the doctor if you're not feeling well or if you get hurt, but you also go to the doctor for regular checkups. After you turn 3 years old, you should go to the doctor at least once a year for a checkup. If you haven't quite turned 3 yet, you might be going a little bit more frequently. Just like going to the dentist, I know going to the doctor can be a little scary. But if you know what to expect, it makes the experience less scary. So let's talk about what it's like to go to the doctor for a regular checkup. Once you get to the doctor's office, the nurse is going to bring you to the back. A nurse is a specially trained person to help take care of you when you're sick and to help you when you're hurt. The nurse's job is to gather information. She gathers this information to see how you're growing strong and healthy. The different things that the nurse will do once you get to the doctor's office is to check your weight, check to see how tall you are, check your temperature. I have a real temperature here and a pretend temperature. And they're also going to ask how you've been doing. And it's okay to ask questions back as well. Then they're going to record all of the information into a chart. Once all the information is recorded, the nurse is then going to take your blood pressure. A blood pressure is the measurement of how hard your heart is working. To take your blood pressure, the nurse is going to put on what's called a blood pressure cuff on your arm like this. She's going to pump up the air, and you're going to see the needle starts going higher as she pumps more. It squeezes a little tight, but it doesn't hurt. Then once the air is released, he or she reads the numbers and comes up with what's called your blood pressure. After the blood pressure is checked, the nurse then checks your hearing and your sight. To check your hearing, you'll likely go into a room where you wear headphones. The nurse then will trigger sounds to come either on the left or the right side of your ear, and you have to tell her which side you hear it coming from. Usually it's a chirping bird, so it's sort of fun to hear. And then the nurse is going to check your sight. How they do this is have you stand on a line and read what you see on the chart. He or she's going to have you step back further and further and read further and further down the list. This is how they can check for near sight and far sight. After that's complete, it's time for the doctor to come in and do their assessment. He or she's going to come in and ask you how you've been doing, how you've been sleeping, how you've been eating, how you've been getting along with friends. And then they're going to start using their instruments. First, they listen to your heart and lungs with a stethoscope. This is called a stethoscope. The piece goes into your ears, and this piece, called the bell, goes over your heart. They're going to listen for several seconds because there's different places to listen to the heart to make sure that all the proper areas are checked. Then they check the lungs. They're going to ask you to take a deep breath in and a deep breath out. They're going to check all 4 areas or lobes of the lungs is what we call them. After that, the doctor likes to check reflexes. Have y'all ever seen one of these? They're going to hit different areas of the body to see how your body reacts to them. They're also going to look into your ears, your nose, and your throat. Ah. also going to feel around on your belly to see how that's feeling, and that might tickle a little bit. Then the doctor's going to have you stand up and bend over, touch your toes so that he or she can look at your spine to make sure it's growing nice and straight. The last and final piece of the checkup is the immunizations or shots. These are so important. They help keep you from getting sick and staying healthy. It's okay to be a little scared, but it's over before you know it, and it just feels like a little stick and it's all over. I have a pretend one here. All done. And then you'll likely get a sticker for being such a great patient. Now, I want you to pretend to be the doctor. Try to find some things around the house that mimic either a shot or a thermometer or a stethoscope, and you get to play doctor. And just like going to the dentist, the more you practice, the less scary it is. Have fun.